a topic which has more controversies and more disinformation or misinformation than the science, thanks to the social media and the mushrooming of professionals. Since this field is not as well regulated as we all experience it in our practice, that perhaps it is easier to change a man's religion than to change his diet, as Margaret Mead said. And there is some proof there. So God said, do not eat apple, and that was the first dietary intervention that failed. Is the fact that we are thin fat Indians. We are thin by conventional criteria, but centrally obese. Our abdominal obesity fat is much higher, and we also have, along with that, obviously lower muscle volumes compared to other ethnic groups. And this is the beginning of insulin resistance. The crash diets basically cause yo-yo dieting, where you lose weight and gain, lose weight, regain. This is in fact more injurious to health. It is better to be slightly overweight than yo-yo.
Hello, thank you for tuning in. If you want to come back to this video later, just tap on the like button. It will save it to your like video so it's easier to find. And don't forget to hit on the bell icon to get notified whenever we drop new content. Stay curious, keep learning, and see you on the inside.
A very good evening to one and all. And let me share the screen with you so that we can start. We're going to be talking about uh, a topic which has more controversies and more disinformation or misinformation than the science, thanks to the social media and the mushrooming of professionals. Since this field is not as well regulated as medicine, we are getting there. But yes, so let's start. Yes. So we've always been told and heard that we are what we eat, right? And even the father of modern medicine, Hippocrates, told us many years ago, centuries ago, that let food be thy medicine. And this is so very true in this day and age where there is an epidemic of the NCDs, the non-communicable diseases, or the so-called lifestyle diseases, whether be it obesity, diabetes, hypertension, dyslipidemia, coronary heart disease, MASLD, gout, or osteoarthritis. The origins of all these diseases lie in nutrition, in what we eat. Uh, what we eat leads to obesity, and then that is the beginning of many of these so-called lifestyle diseases. So a very very recent study which has been published in Nature just last month, which is based on the ICMR India survey, which covers almost 18,000 people, uh, has told us that the prevalence of generalized obesity and abdominal obesity is as high as 28.6 and nearly 40% respectively. So this is nearly one in or four people out of 10 have abdominal obesity, and the numbers are only increasing. By 2016, the economic cost of overweight and obesity are projected to reach uh, almost 2.5% of our national GDP, and NCDs account for nearly 60% of all deaths in India. Unhealthy diets, of course, contribute substantially to the NCD burden. Improving diet and physical activity can prevent nearly 50% of incidence of type 2 diabetes, which is again reported to be uh, prevalent at 11.4%, and that of pre-diabetes is at 15.3%. Given the enormous public health burden of NCDs and their associated economic costs, it is crucial to identify cost effective practical strategies for reducing the NCD risk. And that's where the lifestyle modification basically comes in. Now, to eat is a necessity, but the issue is that to eat intelligent is an art and science, of course. But then we also know, and we experience it all the time, we all experience it in our practice, that perhaps it is easier to change a man's religion than to change his diet, as Margaret Mead said. And there is some proof there. So God said, "Do not eat apple," and that was the first dietary intervention that failed, right? Coupled to this is another challenge, which is very peculiar to us as Indians, is the fact that we are thin fat Indians. We are thin by conventional criteria, but centrally obese. Our abdominal obesity fat is much higher, and we also have, along with that, obviously lower muscle volumes compared to other ethnic groups. And this is the beginning of insulin resistance. And this is very well depicted in this very famous picture. Lot of you must be aware of this and seen it at various conferences. So Dr. Gyagnik from Pune is sitting next to his Western counterpart. He looks much smaller, leaner. Both share the same BMI of 22.3, but when it comes to the body fat percentage, surprisingly, Dr. Yagnik is at 21%, and Dr. Yutkin, who looks much larger, bigger, his fat percentage is only 9. And this is actually borne out even in our data. So when we at my clinic, we took a sample size of around 360 patients, and you can see that nearly 50% of the patients are in the normal to underweight category, right? Half of the population is, but still the percentage body fat, even in this so-called healthy weight, healthy BMI population, was at 32.6%, when the ideal is 12 to 18% for men and 18 to 24% for women. So we basically, even in the so-called healthy normal weight population, you can see that the fat percentage is high. So this is, I mean, we already are we start off on a back foot. And then that is something which perhaps we can't change very easily. But then there are these additional challenges which we basically need to work on significantly. And that is that we, as again, as a country, are a very carb heavy country. We just love our carbs. We eat a lot of carbs, whether you go east or west, north or south, doesn't matter. Again, the recent survey has told us that Indian diets are characterized by low quality carbohydrates, which basically mean white rice, milled whole grains, basically flour and added sugar, high levels of saturated fat, and low intakes of protein. Uh, so this is what is kind of come out just last month, and it has been proven time and again. Now, this high carbohydrate intake, which is pegged at say 62.3%. So, out of our caloric requirements, 62.3% of the calories are coming from carbs, and primarily from refined carbs and milled whole grains. Now, this represents a major risk factor for NCDs and should prompt actually policy action to lower consumption. It has been postulated, and which is true, that widespread reliance on subsidized rice and wheat um, likely drives high cereal intake, highlighting the need to prioritize pulses and legumes, basically the dals and lentils, which should also be available perhaps at subsidized rates. This is at a national policy level that we are talking about. When the patient comes in at individual level, also we need to drive home this message, because even the other statistic, for example, Swiggy statistics for 2024 tells us that out of the 10 most ordered dishes, 7 are rice based. In fact, biryani topped the charts, and 95 biryanis were ordered every minute in 2024. And this is, on a lighter note, this is even percolating down to children, and therefore we see childhood obesity also on the rise. So when a child is asked name any two sources of food, it says plant, animals, and then the OTT platforms, because that's what uh, he thinks or she thinks the food is coming from, right? So we've understood that we do eat a lot of carbohydrates. Our carb intake is the big issue. So then, are we getting enough protein? So again, the survey tells us that protein deficiency amongst Indians stands at more than 80%. Added to this, the Forbes survey tells us that 93% of the surveyed population is not aware of their protein requirements. And there are multiple myths around protein. So 85% thought that regular daily diet is enough for the daily needs, and more than half thought that high protein diet is actually bad for health. 92% of the 84% of the population thinks that green leafy vegetables are a very good source of protein, right? So this just tells us that there's a lot of work to be done. There's there are a lot of myths to be cleared, and a lot of knowledge to be shared. Patient education, a lot of patient education is required. So if you can see here, I mean, you'll all agree that this is like a typical Indian diet. You start with upma, poha as breakfast because they're considered healthy breakfast options. Lunch is roti, sabzi, maybe dal. Most office goers don't carry it because it's too messy. Evening snack is generally either some kurmura or bale or chivda or bag of wafers. Very often, even vada pav and noodles come in, or chaat comes in. And then the fetish for variety and quick meals at dinner again gives us very often the options are biryani and noodles and pasta and pizza, especially if there are children in the house. So you can see that where is the protein here? That little dal, katori of dal, which is at lunchtime, if at all, is the only protein. The rest all is just lot of carbs. So overall, the Indian diet is primarily vegetarian, because even the non-vegetarians, even if you have non-vegetarian food once or twice a week, you are called non-vegetarian. It's not like all non-vegetarians have non-vegetarian food at twice in the day every day. So it's primarily vegetarian, very high in carbs and low in protein. And therefore, we are not meeting our protein requirement of zero point 0.8 grams per kg body weight, which means that if you're a 60 kilo person, then you need 48 grams of protein in the day, right? Now, again, the India ICMR study has shown that protein intake was low at 12% of energy. It provides only 12% of your energy, where the RDA is 15%. And the suggestion made is, and we see that all the time in practice, and we practice that, and which gives us results. Just replacing even 5% of the energy coming from carbohydrates, if we can replace it with protein, which comes from plant or dairy, or for the non vegetarians from egg or fish, would lead to number one, weight loss, and therefore reduction in insulin resistance with an associated lower risk of type 2 diabetes and pre-diabetes. um, and pre-diabetes now is also considered an independent risk factor uh, for your cardiometabolic health. It's not only when you become a diabetic that the problems arise. And in this new day and age where the newer weight loss drugs are mushrooming, uh, they are already being Monjaro has already become the India's second highest selling drug. There is urgent need to address sarcopenia because that's the most important side effect, and therefore the protein intake. For To avoid muscle wasting, we will have to up the protein intake. So, how do we bridge this gap? Well, basically, we need to include protein at each meal. Not just that, we in fact need to replace some of the carbs with protein. It's not you continue eating your four rotis and a big katori of rice and just add a katori of dal. No, we need to replace two rotis with a katori of thick dal. Automatically, from four rotis, you will be able to eat two rotis if you add that big katori of thick dal with your meal, or say a katori of yogurt, skim milk yogurt. For this, first of all, we need to know, and our patients need to be made aware of which are the protein rich foods and the carb rich foods. Now, here, most of us know that, of course, pulses, dal, dairy, soy, uh, and eggs and meat for the non vegetarians are protein rich sources. But we also need to understand that even humble grain like rajgira and all the millets have a higher protein content than our traditional wheat and rice. So even if we can encourage them to change that kind of rotis, or in place of rice have the millet, it works. So crowding the diet with more protein rich foods will automatically crowd out the carb rich foods, as I said. So instead of one uh, half cup of thin dal with 3 4 rotis, if we add one katori of thick dal, then the rotis will become two. So simple tricks, but it can help cut down the carbs and up the protein intake. Again, identifying sources of carbohydrates. People show a lot of surprise when we tell them that poha, kurmura, upma, which is primarily made of rava, which is again highly refined wheat, spikes the sugar, will lead to weight gain because they are considered generally so-called healthy light options. Similarly, the khari and butter biscuits, all the maida based items, and fruits. The most surprise is shown when we tell our patients that fruits are primarily carbohydrates. So, this knowledge needs to be shared. And of course, simple carbs. Everybody knows about sugar, but again, there's this constant and big myth that jaggery, honey, organic sugar is healthy and that can replace sugar and that can be had in any quantity. No, they have the same calories as white sugar, and they also spike the sugar, blood glucose levels as much. So these are not some great alternatives, whether we are looking at weight loss or even at insulin resistance. And similarly, we need to say no to, of course, white rice, very refined rava, wheat rava, maida based products like white bread, biscuits, and similarly noodles and pasta. Now we have a lot more healthier alternatives available in the market, but the traditional, the original ones definitely need to be cut down. Now, as we discussed, it's not easy to change one's diet. So if you're going to completely revamp the diet, it will remain as a piece of paper. There will not be any compliance. Even if the most enthusiastic will do it for a week, 10 days, and then it won't be sustainable. So we need to offer them simple, easy tweaks where you just need to make few changes, little changes, but you're still achieving the goal. So, for example, instead of aloo paratha, if we ask them to do vegetable paratha with a katori of dahi or a paneer paratha, it works. Toast, instead of just having toast, if we have egg with it, or like paneer toast, again we've achieved the target. Poha needs to be had with lots of sprouts and a few peanuts and sprinkle some lime. Again, the glycemic response goes down. The We are bringing in the protein. So this is how we need to give them options. You cannot just start asking them to do completely different exotic dishes, which is not going to happen. Also, the other problem with the meals today is, of course, the portion size. So 20 years ago, a cup of beverage would be like 45 calories, and now the same could be anywhere around 330 to 400 calories, right? A cup of Starbucks coffee. A popcorn at your movie theater was 270 calories 20 years ago. Now we are only able to buy a tub which is a whopping 1030 calories, which is almost like 70% for a lot of people, 60 to 70% of your daily requirement. So, portion size explosion is also something we need to be aware of. And some simple tricks again. Which plate contains the most food? Well, the food is the same in all plates. It's the visual appeal. So s- if we ask our patients to start serving themselves in the small plates, especially when you go for buffets, like take a dessert plate rather than the big plate, again that would help to cut down your intake. So how should one plate look like? Very, very simply, if we can send this message across that if this is your plate, half the plate needs to be filled with vegetables and salads, one fourth of the plate needs to be protein, and just a little more than one fourth needs to be carbohydrates. Just now what is happening is that three-fourth of the plates are filled with rice and roti, and there is some vegetable and very little protein lurking there. In fact, with the healthy plate, we want also a portion of dairy on the side, and the suggested portion is 250 ml of milk, yogurt, curd, or paneer in a day at least. Um, Besides talking about the macronutrients, the carbs, the proteins, uh, water is the other important macronutrient, because we know human body is 58% water, and every time we should not be going by our thirst sensation, because if we are sitting in an air conditioned office or AC setting, we are rarely going to be thirsty. We need to make sure to drink at least 6 to 8 glasses of water in a day, and coffee does not count because coffee has a dehydrating effect. So tea counts, your buttermilk soup, that can be part of your fluid intake, but not coffee. Why drink water? Of course, it increases our metabolic rate, fills you up, curbs appetite, and flushes out toxins. So this was basically the basic challenges that we face in our Indian diet. Now, if we talk about obesity, in fact, now obesity is recognized both as a disease and a chronic clinical condition. It's not something that you can just say, oh, the person is lazy and therefore the person is putting on weight. Now, this excessive fat accumulation or obesity has effect on all the systems in the body, be it the cardiovascular, the GI, reproductive, musculoskeletal, and each has its own manifestation. So, musculoskeletal, it will lead to back pain, osteoarthritis. GI will lead to reflux, also, of course, the fatty liver or MSLD, and so on. Uh, yeah, sorry about this. The cursor is.
Ma'am, yes, you can click on the right arrow.
No, yeah, I'm just trying to.
Yes, click on it multiple times, ma'am. They'll come one by one, each line.
Yeah. So, in fact, no medical condition has generated as many dietary approaches as obesity. And I'm sure you'll agree on this one. Now, causes of obesity in very simple terms, it's of course imbalance of energy intake and energy expenditure. And the drivers of energy intake and expenditure are both homeostatic and non homeostatic. And the homeostatic drivers are, of course, the hormones, which include the ghrelin, leptin, the neuropeptide Y, GIP, GLP-1, insulin, uh, and the non-homeostatic, which basically what we call hunger hormones and appetite hormones, right? And of course, the mechanisms are quite complicated. For want of time, we are not going to go into that, but the homeostatic control, in fact, drives us. These hormones drive us to want to consume more food or to stop eating. Uh, and in fact, what we do realize is that there are some people who do not. There are some people who, without ever monitoring their food intake or calculating how much to exercise, remain within a relatively stable body weight range. And that is because the homeostatic control is being maintained. And now there are non homeostatic drivers of energy intake and energy expenditure, which basically, and these are, a lot of them are, of course, environmental triggers. So, how much carbohydrates we eat, like we eat a lot of carbohydrates, the alcohol intake, the fat intake, And on the expenditure side, your physical activity, your need, these kind of again also have an effect on your weight. Now the drivers of non-homeostatic expenditure are, these are the environmental triggers, right? Increased consumption of high caloric foods, easy availability, convenience foods, food being ready at your, arriving at your doorstep in 8 minutes. And now nobody goes, a lot of people don't go to even go and shop. You blink it, you blink your eye and everything is delivered in minutes, right? So further leading to sedentary lifestyle, sleep deprivation, excessive screen time. So these are the non homeostatic drivers which is leading to obesity. Now the hedonic theory tells us that human behavior is motivated by the pursuit of pleasure and the avoidance of pain. And this is what comes in with this obesogenic environment. It is all very so tempting, right? So the non homeostatic drivers kind of overcome the homeostatic drivers. And this has been postulated as one of the mechanisms why the obesity is on the rise. And again, there are enough statistics here. The ICMR study tells us that we as a country account for 15% of the global sugar consumption, and added sugar consumption is higher than the recommended 5% of energy in most states, and exceeding and has exceeded levels reported in the survey, which is 15 grams per day. So excess added sugar further endangers public health. And again, there are some public policy issues which need to be addressed to really cut down on this. So the increasing prevalence of obesity is partially related to the ready availability of highly palatable foods, which increase the incidence of hedonic, non homeostatic feeding. And again, on the lighter note, it's not only affecting the humans, but perhaps the other species too. So, as I explained to you, the hedonic drivers are overriding the homeostatic signals in response to rewarding food items. And this is basically causing a big jump in the number of obese people, and what now they are terming it as hedonic obesity. Okay, so the most common question that people ask in the clinic is what should be my ideal weight, right? For a lay person, height for men, height in centimeters minus 100, for women, height in centimeters minus 105, or the body mass index, or even better, of course, is the waist circumference measurements, because as we know, abdominal obesity is the big issue. So even if your BMI is in the healthier range, still that's not ideal. Now, the three paradigms of weight loss and management for obesity treatment are, of course, behavioral, where we talk about the calorie deficit, physical activity, the pharmacological, where up till now we did not have very effective drugs, but the new GLP-1 RA and the GLP-GIP drugs show abundant promise, and they are, as they've already scaled the charts. And then of course the surgical treatment in terms of bariatric surgery was in fact has always been available, but that's not for, of course, majority of the population. So no matter what, the weight loss equation still remains. You need to decrease intake, increase output, create a negative balance, and that is what leads to weight loss. So, some number crunching here: 1 kilo of fat is equivalent to 7,000 calories. Daily caloric deficit, if we create, of 500 calories by eating 300 calories less and exercise worth 200 calories, burn 200 calories, then we'll have a 1 kilo of weight loss, fat loss in 2 weeks. How long will it take? Again, the most common question asked. Sensible and realistic goal is half to 1 kilo a week. Men lose much faster than women, and also the higher the BMI, faster will be the weight loss. You lose much faster. Middle age spread is the time when often fat is deposited on the abdomen and trunk, and that's the more dangerous one, as we discussed, the abdominal fat. And this has serious health implications because abdominal weight gain contributes to insulin resistance, dyslipidemia, and all the NCDs that we talked about. This becomes a problem, especially in women at the time of menopause. There is a sudden drop in metabolic rate, and therefore lifestyle changes are required. Women need to eat, start eating less, and increase activity. If you continue eating what you've been eating for the last 30 years, there will be weight gain. And therefore, the pear shape turns to apple shape, which is the problem, because it's, again, as I said, the abdominal fat, the fat deposition around the abdomen, which is the problem. So again, everyone asks, how do I my metabolism is slow, how do I boost it? Eat lean protein and good carbs. I think that is very important in the Indian context. Step up the protein intake, reduce your carbohydrate intake, drink sufficient water, sleep tight, exercise. So it's all about lifestyle. It's not only about the what you put in your mouth. The sleep also matters, the physical activity matters, which we'll just talk about later. So the initial weight loss target should be 5 to 10% of current weight. In fact, maximum health benefits are achieved with this initial weight loss. And in fact, we've seen that as little as 3 to 5% weight loss also improves outcomes. It reduces diabetes risk, improves blood pressure, dyslipidemia, even the knee pain kind of is reduced. And most clinical guidelines suggest about 5 to 10% weight loss, as I mentioned, not because it is the optimal amount, but because it is achievable enough to be recommended in clinical practice. If you're going to tell your patient you need to lose 25 kilos of weight, it's not happening. We're starting on a back foot. He's going to run away, and he thinks it's absolutely unachievable. So why bother? Besides number crunching, of course, satiety is a very important factor for sustained weight loss, because you cannot ask our patients to eat less calories, remain hungry, and lose weight. That's not going to happen. So, strategies that make you feel full for a longer period are the key to weight loss. And again, that's where protein comes in, because protein delays gastric emptying. It makes you feel full for a longer time. Protein also prevents insulin spikes, and therefore there are less food cravings. Along with protein, we need high fiber foods, which means complex carbohydrates which are unrefined. Um, so it will be like dalia, brown rice, millets, our jawar, bajra, even rajgira, amaranth. They have reduced caloric density because of the presence of fiber. They delay gastric emptying and therefore promote satiety. So, caloric distribution for a weight loss prescription should be carbohydrates in the range of 50 to 55, which we are at the moment 62, as we discussed, 62, 63. This is the average. In some parts of the country, it is even reaching 67 to 68%. Fat should be less than 30%, and protein should be providing 15, at least 15 to up to 20% of calories. So, again, very simple terms, include protein at each meal, which is now called also protein pacing, that there should be protein rich foods at every meal, and not just include, replace some carbs with the protein, not just add a katori of dal to your existing plate. We'll need to cut down some carbs and add the dal. This is especially true for the vegetarians, because all the pulses and dals are also 65% carbs. So we are adding to the carb load. So we will have to cut down the frank carbohydrates, the roti or rice, and then include dal or pulses. So, as you would have seen and experienced, that diets come and go, right? In fact, there's a kind of an entire diet emporium. Every few months or Every year there is a new diet on the horizon. uh, so currently we've all seen gone through the paleo and the gluten free diet and the General Motors diet, which has been the oldest of the crash diets, keto, and of course intermittent fasting is the flavor of the season. All the fat diets work on the principle of restriction of entire food groups. So in keto you completely almost eliminate carbohydrates. In vegan you completely eliminate dairy and all the meat. So of course you limit your choices. There is the caloric intake drops and weight loss occurs. Now a drastic reduction in caloric intake obviously is almost like semi starvation. Body lowers its metabolic rate because it senses starvation, it's not getting sufficient calories. You can't sustain fat diets for long anyways. You go back to your old habits and the weight regained is more and faster. So if you manage to lose 5, now you'll gain 7 kilos, which is kind of almost guaranteed. Weight gain is guaranteed. um, so crash dieting is harmful. There is weight loss, but there is also guaranteed weight gain. Subsequent weight loss becomes more difficult. There's hair loss, dry skin. Uh, with weight loss, there is increased risk of gallstones. Of course, low BP, weakness, fatigue, vitamin and mineral deficiencies, and in some cases, we also have hospital admission. Uh, so the crash diets basically cause yo-yo dieting, where you lose weight and gain, lose weight, regain. This is in fact more injurious to health. It is better to be slightly overweight than yo-yo. So I'm only going to be talking about intermittent fasting in brief, because that is the flavor of the season. Intermittent fasting is an idea which is done in various ways. The most common is that you there is time restricted feeding. Every day you only eat within a time period of 6 hours, 8 hours, 10 hours. There is research still going on. When we are talking about weight loss, the science is not very clear whether intermittent fasting really works. As we gather more information on IF, what we can say is that have an early dinner, eat majority of calories relatively earlier in the day, and completely avoid late night snacking. So even if you want to follow intermittent fasting, it needs to be early time restricted feeding. You start early and finish early. You don't start at 1 p.m. and then go up to 10 p.m. That is not intermittent fasting. Also, a very recent study has shown that an interval of more than 14 hours is perhaps counterproductive. So people have been doing 16 is to 8, 20 is to 6. We don't need to do that. Even if you keep your interval time period for eating between 10 to 12 hours, that is good enough. So in very simple terms, you use your time in bed as a guide to determine the best 10 to 12 hour eating window. You must avoid food for at least 1 hour after waking up. Eat in the next 10 hours and stop eating 2 to 3 hours before bedtime. Uh, this is what you need to follow. There is no need to go to extreme measures of 16 is to 8, or 20 is to 6, or people even do 20 is to 4. uh, so keep an interval, uh, eating window of 10 to 12 hours. That also works. So we need to go back to what we've been taught always: eat breakfast like a king, lunch like a prince, and dinner like a pauper. This is the other important issue when it comes to increased caloric intake: emotional eating. We eat not only when we are hungry, but when also when you're bored, when one is even happy. So food is to be, it's not had only when one is hungry, as I said. When one is bored, one is depressed, one is happy, the food intake happens. And perhaps again, there is some truth there. Stress spelled backwards is desserts. However, we need to understand that whatever the problem is, the answer is not in the fridge. And in fact, we we understand that if one can't resist a food, then one should not buy it. It is very very difficult for that food to be lying on your kitchen counter and then you know you have to not have it. That's not very easy, because if you eat something and no one sees you eat it, perhaps it has no calories. So these are again some simple behavioral strategies which we need to discuss with our clients or patients. Dangerous weight loss strategies: Ayurvedic powders and tablets. Just because it is herbal or natural doesn't make it safe. We all know that. Mono diets. A lot of commercial weight loss centers suggest having 1 dozen apples every day or 1 kilo of paneer in a day. Obviously, we cannot, this is not sustainable. So, do not fall for that. Programs which say no exercise recommended, again, not the right way of doing it. And then of course we need to be wary about self-styled health coaches. Now we have health coaches, we have metabolic coaches, wellness experts. These are all self-styled gurus. Someone who has lost himself herself 7 kilos and starts uh, telling us what to do, suddenly she or he knows all of nutrition, right? uh, some some of the professionals just hang on to one celebrity client and also tell the public what they want to hear. So one needs to be very very wary of the professionals also. uh, you need to understand the qualifications of the dietitian or the nutritionist whom you are going to or recommending. Some more weight loss gimmicks: vibrators, heat belts, spot reduction machines, massage, steam and sauna. Very often our patients ask us very seriously that, I get massage done and then I go for a steam. So that will help me with the weight loss, right? I said, of course it will. It will help the person who's massaging you, the masseur. That person is going to lose the weight. So there are no simple solutions for weight loss, but it is not impossible to lose weight. It is tough, but it is possible. So the National Weight Control Registry in US has kept a tab of people who have lost around 30 pounds or 13 kilos and kept it off for a year or longer. Today, they have more than 10,000 people in this registry with an average weight loss of 30 kilos and who have kept it off for more than 5 years. So far, they have found that the vast majority changed their diet and started exercising more. So, what did they do besides this? Eating breakfast every day, weighing themselves at least once a week, and watching fewer than 10 hours of TV, or, of course, now any platform. So, it's not, again, besides eating, there are behavioral changes that also need to be made. So, weigh yourself. We need to ask our patients to weigh themselves at least once a week to keep a tab. Fewer than 10 hours of screen time a week. I think this is again a very, very important factor in this day and age. We know that sitting is the new smoking, and WHO recommends screen free time of at least 2 hours. And in fact, now there are screen time recommendations by age also. So, for teens and adults about 18 and up, it's 2 to 4 hours. And as you can see here, there are recommendations age group wise. Sleep again is a very important part of the equation for weight loss. Chronic sleep loss can lead to alteration in hormones that may make one eat more and hold on to every last extra kilo. Beyond this benefit, sleep has been found to be a strong force against inflammation, Lack of sleep can also lead to an acceleration of skin aging, increased risk of Alzheimer's and other neurological condition. And for all this, it is best to skip the late night OTT shows and screen time to ensure a healthful sleep. So this is a very big challenge in shift workers, and even otherwise, post COVID, I think there has been this huge culture of binge watching in the night, and then obviously one tends to eat at that time also, because one is now hungry post dinner, or one likes to munch on something while watching a serial or a show. So I think that is in fact doing the most damage. So again, there are recommendations for hours of sleep by different age groups, and for adults, it is 7 hours or more. So with this shift work and the exposure to blue light, because a lot of people tend to scroll social media while lying in the bed, and of course watching the OTT platforms, this has increasingly led to a misalignment between food intake and the circadian rhythm, the light and dark cycle. And studies have shown that misaligning feeding times with circadian rhythm is associated with obesity. In fact, nighttime binging is worst form of dietary intake. Physical activity, of course, is the other important component, right? And there are always excuses. In very simple terms, if we don't use our muscle groups, we'll lose it. So use it or lose it. That's the simple message. And also, there are always some excuses for not doing physical exercise, and these are some of the smarter ones that I've come across in my practice. So we need to be stronger than our excuses, because there are numerous benefits of physical activity besides, of course, burning calories or creating a caloric deficit. There are physiological, social, psychological benefits, and combination of cardiovascular exercise and weight training or resistance training is what is recommended. And again, in this day and age where with the newer weight loss drugs, where there is increased risk of sarcopenia, we need to urgently address resistance training or weight training. And again, there are physical activity guidelines given by WHO. So it is at least 150 to 300 minutes of moderate intensity exercise, or 75 to 150 minutes of vigorous intensity exercise, or it could be a combination of both. And what we discussed, the hedonic theory, that human behavior is motivated by the pursuit of pleasure and avoidance of pain. This could be used positively for physical activity, where we encourage our patients to engage in physical activity that they enjoy, because only the physical activity which gives enjoyment will be continued. So we need to spend time to discuss this with our patients uh, for higher compliance. Otherwise, there will be a tendency to outsource that also. And these calories count, the physical activity counts. If you can see here, for example, basically it is very difficult to match the caloric intake with caloric expenditure. A plate of samosa is around 312 calories. For this, one would have to walk for an hour to burn those two samosas. And if you want to have uh, French fries, it will be, you will have to mop the floor for more than 1.5 hours to burn those calories, right? So there's it's very easy to take in the calories, but it takes a lot to burn those calories. And also, calories out have an influence on calories in. So it has been seen that at very low levels of physical activity, there is inability to regulate appetite and energy intake. And whereas at higher levels of physical activity, there is increased ability to appropriately match our caloric intake. So this again another multiple many benefits of physical activity. Coming to some of the most common questions and controversies that we come across in the clinic. Fruit juices. Oh, I don't drink the packed juice. It is made fresh at home and I have it. We would rather eat the calories, eat the fruit rather than drink them, because the caloric intake goes up, the carb intake goes up, the sugar spikes. Same is the case with coconut water. These are sources of natural sugar and they need to be restricted. And of course, aerated drinks. Here you can see a can of aerated drink will have 10 teaspoons of sugar. So we need to be really, really wary of this and counsel our patients. Very often patients ask, does alcohol have calories? Of course, alcohol has, and it has 7 calories per gram, which is more than what a gram of carbohydrate or protein will give. It is just next to the calories that a gram of fat gives. Avocado is again the flavor of the season. I'm sure a lot of patients may be asking you or telling you that they have it. One needs to be aware that it is high in calories. One third of avocado gives 80 calories and around 6 grams of fat. So, uh, one has to be careful. One full avocado will be almost 240 calories with around 18 grams of fat, which is like almost little less than 4 teaspoons of fat. So this is not a it is a calorific food, so it has to be had in moderation, and it's not as superfood as it is made out to be. Similarly, nuts, you one must include nuts in the diet, but 100 calories come from this. So there is a huge variation. Just 3 Brazil nuts give 100 calories and 25 pistachios give 100 calories. So again, one needs to be aware of this. Seeds have become very popular. Great to have a variety of seeds in your diet, but again, they are calorific, so you need to be aware of the portion. Chia seeds give the least, while sesame seeds and sunflower seeds give a lot of calories for the same 30 grams, which is around 2 tablespoons. While going shopping, a lot of patients and clients are confused. We need to understand that Indian regulations tell us that the highest concentration of ingredient should be first. So look if the food also contains added sugars. For Look out for words such as glucose, fructose, sucrose, honey, molasses. They all mean the same. And again, don't only look for sugars, you need to look out for total carbohydrates, which means you need to look out for refined flour, maida, modified starch, maltodextrin. All of them basically are refined carbs. uh, Try to look for carbs per serving, which doesn't always happen because it's per 100 gram serving can be very, very confusing, and that's how it's generally labeled here. So if you can see this label, it's per 100 grams, and here you can see potato is the first labeled item. So the maximum uh, calories are coming from potato, which is basically carbohydrates, followed by vegetable oil, which is not the best, the palm oil, which I'll be talking about later, followed by sugar, followed by starch, and then the salt. So, where is the nutrition, right? We need to be uh, telling our patients to read the labels, at least to get a sense. Talking about labels, we need to look out for the tricky labels: hydrogenated fat, which means trans fat, which we need to completely avoid. Cholesterol free oils, this is a clever marketing gimmick. No oil has cholesterol, it's the kind of fat which is matters for raising cholesterol. So do not fall for this. Sugar free mithais, again, if there are 2 or 3 figs compressed to make a anjeer barfi, the natural sugars are high. That is still the calories are there and it's going to spike the sugar. Should I be taking a Vitamin supplement, another common question asked. If you have irregular eating habits, you're eliminating entire food groups because you're following veganism or so. And people whom I call professional dieters, who are always on some diet or the others, and those who exercise very regularly may benefit from a multivitamin supplement. We know vitamin B12 deficiency is very commonly seen. It's more common in people who avoid, vegetarians who also avoid milk and dairy products, because that's where vitamin B12 basically comes from animal foods which come from animals. Vitamin D is called the sunshine vitamin, which is implicated in many health conditions. And again, the deficiency is very common because the sunlight doesn't work in many of the cities. Um, Fatty fish, cod liver oil capsules can be had but should not be had indefinitely, because vitamin D, we cannot have excess vitamin D in the system. It's a fat soluble vitamin which is stored. Uh, Low fat diet or a no fat diet, we are always looking at a low fat diet. Plant fat is less harmful than animal fat, exception being coconut. So we would prefer plant fats over animal fats, and animal fats of course also include all the dairy fat, which is primarily saturated fat. So the ICMR India survey also tells us that the saturated fat intake exceeds the recommendation in many states, and this is likely due to high intakes of ghee in the north and the use of subsidized palm oil and coconut oil in the south. Also, palm oil, because it is lower, it is cheaper, it is widely used in the food industry and in processed foods. So we need to be wary of this. A lot of people are moving towards ghee as the only cooking medium. That has to be highly discouraged. Whether it's pure ghee, cow's ghee, asli ghee, they all mean the same. They are all in high in saturated fat. So ghee has to be used in moderation. Milk and dairy products, yes, but the fat needs to be out because it's saturated fat. So we need to have skim milk and skim milk products, paneer and yogurt made out of skim milk. Coconut is only plant fat which is high in saturated fat, so that again needs to be in moderation. Between butter and margarine, butter in small quantities, because margarine is trans fat which is to be completely avoided. Which is the best cooking oil to use? Well, these are some of the choices available in the market now. The other way of doing it is using blended oils, which are also available in the market, or you use different oils for different dishes, which happens in the eastern part of the country where mustard oil is used for making certain dishes and the other dishes are made using another oil. Or every time you buy oil, you may buy different oil. That also works. Is olive oil the answer? Extra virgin, virgin cannot be heated, so they are meant for cold use. The pomace can be used for Indian cooking. Calories remain the same. Just because one is using virgin oil, using olive oil, that doesn't mean you can use liberally. Omega 3 fatty acids, again, very important. This is something that is lacking in our diet. And for the non-vegetarians, it can come from fish. So these are some of the fish uh, in India which will give you enough of omega 3, and just 2 servings of these fish in the week would get you the required amount of omega 3. For the vegetarians, it would have to be uh, ideally a fish oil supplement, and for the very strict vegetarians, algal oil supplements. Otherwise, it would be the flax seeds, walnuts, bajra, spinach, urad dal, which do not still give sufficient omega 3, and therefore the fish oil or algal oil supplements would be useful. There are some very simple foods which are lying on our kitchen shelf, but they are extremely potent. It's almost like a kitchen pharmacy. The cruciferous vegetables, the cabbage, cauliflower, broccoli, are extremely healthy, anti-cancer. Onion, garlic, great for inflammation, great for uh, dyslipidemia also. All the different types of berries are virtual age-defying pills. They are uh, anti-aging. Flax seeds, all the beans, pulses, dals, omega oily fish that we talked about, green tea, uh, are foods which should be included in the diet. And we need to again encourage our patients not to just eat the greens. We need to eat the reds and yellows too. The deeper, the darker, and the variety of fruits and vegetables you have, great. So basically, we need to go seasonal and go local. And balanced diet in the end is no rocket science. If one includes a variety of foods in moderation, then we have achieved the so-called balanced diet. We need to tell our patients it's never too early or too late to change habits and start good ones, because nutrition helps add years to life and life to years. I would like to end on the note that nutrition is a science and not an opinion. So do not believe everything you read on the internet. Seek professional advice, not from Insta, Facebook, and WhatsApp forwards. There is also a lot of noise from the quacks. So seek a qualified nutritionist. Thank you for your attention.
Okay. Thank you so much, ma'am, for your presentation. There have been multiple appreciative comments in the comment section during the presentation. You also had a couple of questions, which I'll take a few. Uh, just one
Yes.
question here. Is there any
Uh,
ma'am, can you see the question?
yes. One is, how is homemade ghee and is it essential fat?
Yes.
As I explained, whether it is homemade ghee, asli ghee, cow's ghee, it is still saturated fat. It is not as it is essential fat, but in moderation. We need to have 1 to 1.5 teaspoons of ghee in a day. The survey has told us that we are doing using far more than we need to. So, and do not use ghee as the only cooking medium. A lot of people have turned to not using oil at all and they're cooking all their food in ghee. That's not what we want.
Yes, ma'am. Uh,
uh,
there's another question, ma'am, here. I'll just.
there is, let me see.
Is there any data on the diet and age of death? And is it related to the diet pattern?
Uh, yes, of course. All of this basically, if we are going to get the NCDs, the lifestyle diseases, it is affecting the mortality. Uh, so there is absolute data in the sense that uh, this whole concept, the whole idea of having uh, the number of calories, primarily in the Indian context, the calories need more calories need to come from protein, less from carbohydrates. We need to moderate our saturated fat consumption. Absolutely important. After all, the NCDs will have a direct relation to mortality, right? So healthy diet, a balanced diet, and you're increasing your longevity.
Yes, ma'am.
All that we discussed. Yeah.
Okay. Ma'am, there's a question about polished and unpolished millets. And
Yeah. So I think that's a very good question. Because millets have been made very popular in the country, the market is flooded with a lot of millet brands and varieties, and majority of them are now polished millets because they cook faster, they taste better. So we need to be really aware of this, and we in fact therefore identify the right brands for our clients, because the client is or patient is completely confused. So you need to make sure that you are buying unrefined millets, whole millets. And still, the portion does matter. The portion size does matter because you use millets. So it's not like you can have as much as you want. Just like as I discussed about olive oil. Just because it's olive oil, you cannot use liberally or in unlimited amounts. And same is the case with millets. And you need to make sure that you buy the unrefined ones.
Okay. Dr. Ravindra Kulkarni has asked in the comments, what are your remarks about the ready-made food that are available, like herbal shake for oral intake?
Can you repeat that, please?
Your view on the ready-made food that is available, the herbal shakes and infusion milks.
Ready-made foods is a very big category. So you are saying herbal shakes.
Yes,
Uh, I mean, if you're talking about protein shakes, then clearly that's a huge big discussion. Um, if you say green tea as a herbal drink, yes, you can have it. Herbal green tea, chamomile tea, yes, they can be incorporated in the diet.
okay. Uh, Dr. Verma has asked white bread versus brown bread. And I'm pretty sure a lot of people in the audience have this query.
Uh, White, brown. Okay, so white bread is definitely a no. Again, brown bread, you will have to make sure of the brand, because unfortunately, uh, some of the brands, it's just that it is caramelized and it's sold as brown bread, or the quantity of fiber is too little but it is called brown bread. So it needs to be more like whole meal, whole wheat, multi-grain, and definitely some brands are much better than the others. So yes, there also we need to give our inputs in terms of identifying the right bread. Also, the bread should always be combined, as we have discussed, with the protein. So
Mm.
if you want to have bread or toast, have it either with an egg white, if you are open to having eggs, or then have it like a paneer toast, chena toast, or you have like beans on toast. But do not just have dip your bread in your chai and have it. No. Yeah.
Ma'am, what is the quantity of omega-3 as fatty acid required in the day? And how many walnuts are recommended?
So the requirement is 2 grams per day. And walnuts, so as I said, you cannot get from, for the vegetarian sources, you cannot get sufficient omega 3 from plant sources. And the number of walnuts that you will have to eat to get 2 grams of omega 3 will do you more damage, harm than good, because then the caloric intake goes up significantly, and walnuts are almost 50% fat. So it will have to be, we generally say you have 2 walnuts or 4 walnut halves in a day.
Okay.
That would be a good quantity of walnuts. Not that that will provide you the adequate omega 3. Therefore, then the seeds come in. The flax seeds are a very rich source. So, therefore, we say nuts and seeds, they all need to be included. And if you're needing more omega 3, then as I said, either you do a fish oil supplement if you're open to it, or if you're a very strict vegetarian, then you can do algal oil supplement.
Okay. Ma'am, we'll take a couple of last two questions because we are in the interest of time. Dr. Rishad Khan has asked, what is the role of exotic fruits in weight management?
Exotic fruits, more than weight management, as I said, the darker, the deeper the color, there are more antioxidants, there are more nutrients, there are more phytochemicals. Basically, we need to have what we call a rainbow diet, where we are having a variety of colored fruits and vegetables in our diet. In terms of weight management, the fruit consumption, as I explained to you, is still fruits are carbs. Okay. And fructose, excessive fructose intake leads to hypertriglyceridemia, hyperuricemia, and of course weight gain, besides spiking the sugar. So the portion of the fruit, no matter which, needs to be measured. Fruits are not a free food. Lot of people have, whenever they're hungry, they have fruits. They have fruit after lunch, they have fruit after dinner. uh, Fruit is not a free food. include a variety, but the portion size needs to be moderated. There are some fruits which have more calories than the others, but those are 4 or 5, but majority of them are uh, can be had in portioned amounts.
Okay, ma'am.
And 1 cup, 1.5 cup is what we generally suggest.
Okay. Ma'am, we have a couple of questions on oils. And I'll just summarize all of them together and ask one question. Give me 1 minute. Can we eat the multiple types of oil like peanut oil, mustard oil, rice bran oil in rotation? And
Yes.
and is soya bean oil harmful? Can it be
Yes,
harmful? Or is
absolutely.
it?
I mean, as I said, that's one of the easiest way. You rotate the oils every time you buy a oil, buy a different one, or you prepare some dishes in one type of oil, say mustard oil, and prepare other dishes in another type of oil. And if you don't want to do all those things, you can buy a blended oil where it's already a mix of, say, soybean and rice bran. So then you don't have to take this effort also.
Yes. Following the same question, does using coconut oil for cooking increase LDL cholesterol?
Coconut oil.
Uh, Using coconut oil for cooking on a daily basis.
Yes, because as I explained to you, coconut oil is the only plant fat which is saturated fat, and which our saturated fat intake beyond the requirement.
Okay, ma'am. I think, ma'am, that is all the questions that, and you've covered most of the questions that have come in the chat in the presentation itself. And for the other questions that have come, these are we'll be having multiple of these nutrition topics in the coming months. So we can address your question in a more suited topic and a more in a discussion that is around your topic. Thank you so much, ma'am, for joining us for this webinar and taking a wonderful presentation with such detailed examples and daily scenarios. And thank you so much for answering
Thank
our
you for having
questions
me.
as well.